Thank you for listening to the Healthy Project podcast, where we get into conversations about health equity, public health, and how to create a healthier community for everyone. I'm your host, Corey Dion Lewis, and together we'll explore innovative solutions, discuss the barriers people face in accessing quality care, and hear from leaders in the field who are making a real difference. Whether you're a healthcare professional, community advocate, or simply someone who cares about health equity, you're in the right place. Let's get started on creating change one conversation at a time. Hello, everybody. Welcome back to the Healthy Project podcast, where we break down the big issues in health equity in ways you can actually use in your day to day. I am your host, Corey Dion Lewis, and today we're going to get into a topic that's at the heart of health disparities: healthcare access. Now, before you roll your eyes thinking, Corey, I've heard this before, stick around because we're about to break this down, hopefully, a little bit different than you're used to. So, what is healthcare access? So, all right, let's start with the basics. What does it even mean to have access to healthcare? In its simplest form, access to healthcare means that people can get the care they need when they need it without facing insurmountable barriers like cost, location, or lack of information. But there's more to it than that. True healthcare access means being able to receive care that's timely, affordable, and this is important, culturally appropriate. And I can't stress that enough because, as we'll discuss, healthcare that's not attuned to the patient's cultural and social needs is still inaccessible even if it's available. The World Health Organization actually breaks this down into 5 dimensions of healthcare access: availability, accessibility, affordability, acceptability, and quality. So, the 5 dimensions of healthcare access. Let's break these down really quickly. Availability. Does healthcare resource do sorry do healthcare resources exist where people need them? If it's about having enough doctors, clinics, hospitals, and services to meet the population's needs, you can have the best healthcare in the world, but if there's only one clinic for 100,000 people, that's a problem. Accessibility. Can people physically get to those resources? Think about rural areas where the nearest hospital might be 50 miles away. That's an accessibility issue, right? Affordability. This one hits home for a lot of people. Even if care is available and accessible, if it's too expensive, it might as well not exist. Affordability is a big contributor to why we see people skipping preventative care and only seeking help when things get really, really bad. Acceptability. This is the cultural piece that I mentioned earlier. Is the care being offered in a way that's respectful and relevant to the patient's cultural beliefs and practices? If not, people may avoid seeking care altogether. And quality. Just having access to healthcare isn't enough. If the quality of the care isn't up to par, we need to make sure that healthcare services are effective, evidence based, and lead to better outcomes. All 5 of these dimensions have to work together for healthcare access to be meaningful. If one of them is out of whack, we've got a problem. And guess what? A lot of them are out of whack, especially when you start looking at marginalized communities. All right, so we've laid out what healthcare access is, but how does this tie into health disparities? To put it bluntly, disparities in healthcare access create health disparities. And this is where the data starts to get real. According to the Kaiser Family Foundation, Black, Hispanic, and Indigenous Americans are far more likely to be uninsured than white Americans. We're talking about 10 to 15% of these populations not having health insurance compared to around 6% for white Americans. No insurance means less access to preventative care, higher rates of chronic conditions going unchecked, and worse outcomes overall. The Commonwealth Fund also found that in 2023, people of color, especially Black and Hispanic adults, are more likely to have medical debt and more likely to avoid care because of cost. And don't even get me started on the fact that these same groups face systemic barriers to accessing quality care, even when they can afford it. Let's take a real world example that most of you will know about: Black maternal health. Black women are 3 to 4 times more likely to die from pregnancy related causes than white women in the US. Why? A huge part of this is due to access. A report by the CDC shows that over 60% of maternal deaths are preventable, which means that many of these deaths could have been avoided if these women had access to proper prenatal care, timely interventions, and doctors who listened to their concerns. So, what's being done to fix this? Well, some progress is being made. The Affordable Care Act expanded access to health care for millions of Americans. Medicaid expansion in certain states have improved coverage for low-income populations, which disproportionately include people of color. But as we all know, the system is still far from perfect. Public health professionals, healthcare workers, and policymakers all have a role to play. But what does that look like? We've seen that Medicaid expansion has a direct impact on reducing uninsured rates, especially for marginalized communities. Push for it in your state if it hasn't happened yet. Increase healthcare workforce diversity. We need healthcare providers that look like communities they serve. Cultural competence isn't just a buzzword, it's life or death for some people. We need to improve telehealth access. Telehealth services have been a game changer for many, especially during the pandemic, especially for people in rural areas. But we need to ensure that everyone has access to the technology and infrastructure to make it work. Because let's be honest, if someone can't afford broadband internet, how are they supposed to benefit from telehealth? Community health workers. Community health workers have been shown to increase health access and education within under-resourced communities. They serve as a bridge between the healthcare system and the community, often filling in gaps that traditional healthcare systems overlook. So, what's the future of healthcare access? We have the tools, we know what works. It's about scaling these solutions and holding the system accountable. The more we, as professionals, talk about these issues and push for change, the more we can reduce health disparities. But let's not kid ourselves. It's not going to happen overnight. However, by making healthcare more accessible, affordable, and culturally relevant, we can start to level the playing field. Everybody deserves a shot at living a healthy life, and proper healthcare access is a big part of that. All right, so here's your action item for today. Think about one aspect of healthcare access that you can influence. Maybe you're a healthcare provider. Maybe you work in policy. Or maybe you're just someone who cares about your community. Whatever it is, commit to making a change. Whether that's advocating for policy reform, supporting telehealth initiatives, or simply providing a safe, respectful space for patients in your clinic. We all have a part to play. So let's keep this conversation going. If you found this episode valuable, I would love for you to share this with a friend, leave a review. All of the resources from this episode will be in the description of this podcast. Again, thank you guys for listening to the Healthy Project podcast. I'll holler at you next time. Thank you for tuning in to this episode of the Healthy Project podcast. I hope you found today's conversation insightful and inspiring. Remember, health is more than just access to care. It's about equity, understanding, and community. If you enjoyed the episode, don't forget to subscribe, leave a review, and share with someone who could benefit from this conversation. For more information and resources, visit us at www.healthyproject.co. If you're interested in sponsoring an episode or partnering on a series, I'd love to hear from you. Reach out to me at Corey@healthyprojectmedia.com. Together, we can build healthier and more equitable communities. Until next time, take care, stay healthy.